So welcome everybody to this webinar. It's great to see you all here. I'm just going to introduce Professor Luca Borodori, who is the chair of the ILDS Patient Organisation Working Group and will be chairing this meeting. So thank you, Luca.
Dear all, dear friends, dear colleague, dear patients, representative, dear patients. So I'm very happy and very glad to welcome you for this special webinar, which has been organized by the ILDS in close collaboration with GlobalSkin. Today's subject, we will focus on the Global Psoriasis Atlas. And psoriasis is a very frequent disease all over the world, not only a frequent skin disease, but a general, so a disease very frequent overall. And this Global Psoriasis Atlas project is a long-term project which aims to drive continuous improvement of our understanding of this chronic disease and to understand how this chronic disease affects and has an impact on the individual and on the entire society. This Global Psoriasis Atlas is a collaborative work between 3 international organizations which have greatly contributed: the International League of Dermatological Society, the International Psoriasis Council, and the International Federation of Psoriasis Associations. So the goal of today's webinars is to raise awareness of this Global Psoriasis Atlas project because it has a paradigmatic importance for other potential initiatives. So we would like to share with you how this project came to be and how it progressed so far. We want to present and share with you the model of how the collaboration and the project has been organized. We want to share with you how the patients have been actively involved, including also patients' organization, and how also patients and dermatological organization can be involved and use the great amount of data which has been collected and is available. And it's important that this knowledge about the Global Psoriasis Atlas project should be replicated to other skin diseases in order to make aware all important stakeholders of the importance or impact of other skin diseases for affected individuals and for the society in general. Next slide. So here you see today's actors and key players under the coordination of Joe Groves, which is our executive director of the ILDS. There will be several experts, including Professor Griffiths as GPA program director, Dr. Tatiana Maasal as a coordinator, Cecily Mburku, also a scientific officer of the International Federation of Psoriasis Association, Professor Peter van der Kerkhoff as chief medical officer of the International Psoriasis Council, and Rebecca Swan as GPA program manager. So these are the person who will give their experience and feedback and give you the important messages. Next slide.
So again, welcome to the meeting. We just have a few pieces of meeting etiquette that will just help the meeting run more smoothly. So please do keep your audio muted unless you're presenting, but do turn your video on. It's great to see all of you, and that really inspires us, and we know who we're all talking to, and we can have a great discussion. Please do use the chat panel. If you do want to ask a question, type it into the chat and the chair will ask you at the end of a relevant section or in the discussion at the end to raise your question. And just to let you know, this meeting is being recorded so we can share it with a wider audience. And we'd love to have a group photo later in the session as well. So that's all on the meeting etiquette. Next slide. And this is the program for the webinar today. So as Luca has already said, a series of presentations from the collaborating organisations and also from Professor Chris Griffiths and Dr. Tatiana Maasal from the Global Psoriasis Atlas. And then we hope to have some time for questions and discussion towards the end. So next. Just very quickly to introduce you to the ILDS, we have 196 member societies from more than 90 countries, and through them represent over 200,000 dermatologists. Our vision is to attain the best possible skin health for all people around the world, and we do this through a variety of methods, including raising awareness, education, research, and obviously the Global Psoriasis Atlas and these sorts of projects cross-cut different areas. Next slide. And our current strategic goal is to strengthen and improve access to skin health around the world through partnerships. So again, the Global Psoriasis Atlas is a really good model for this. It has policy and advocacy components. It also engages with different stakeholders, make sure that they're represented and that we understand the issues. And also, you know, through the research and through the dissemination, there's information which improves education and care. Next slide.
And by these last introductory slides, I just want to remind you that the patients organization working group of the ILDS is the initiator in close collaboration with GlobalSkin and the International Association for Dermatological Patients organization of this webinar series. And our goal is really to develop a framework for efficient engagement and collaboration between with the ILDS and various patients organization and patients leaders worldwide. And of course, our goal is that the patient's voice is considered and to foster partnership between the various stakeholders and patients organization. And of course, the ultimate goal of all our efforts is to improve access to dermatological patient-centered healthcare worldwide. So these were my our introductory words, and now I think that we can start with one of the most important driving force behind this project, Professor Chris Griffiths.
Well, thank you very much, Luca, and thank you very much, Joe Groves and Simona, for putting this meeting together. I'm really excited to be able to discuss the Global Psoriasis Atlas. I've been given 9 to 10 minutes to do this before I hand over to my colleague, Tatiana Maasal. So this actually began not quite in July 2014, but I think this is an important slide. So in July 2014, Professor Darren Ashcroft and I and the then Chief Executive of the IPC, International Psoriasis Council, Steve Odell, visited Stockholm. And we knew a bit about Sweden because we were aware of ABBA. And what we wanted to do was talk to IFPA, who of course are based in Stockholm, and we wanted them to take a leaf out of ABBA's book and ask them, IFPA and others, to take a chance on us and actually bring in this group, which hopefully it's not going to be quite as successful as ABBA, but I want to show you over the next 9 minutes or so is that we have had considerable success because of that successful meeting back in July 2014. So I'm going to talk about the GPA history and the structure, what our achievements are, and I can only touch on those, but they are quite considerable, why the GPA is an exemplar for other disease atlases, and then I'll hand over to Tatiana to talk about our exciting healthcare survey that she's pioneering. So for me and for Darren Ashcroft, this started back in 2011, actually, when we performed the first systematic review of the global epidemiology of psoriasis. And a key finding from that is that there were considerable gaps in our knowledge across the world, and there was a need for a much more detailed understanding of how common psoriasis is, and also therefore what is the burden of the disease. And that was published in 2012 in the JID. Now, for some reason, this is no longer advancing. Don't know why that is. There we go. And at the about the same time, Professor Wolfram Sterry who was the president of the ILDS at that time in 2011, 2012, he and I were very taken by what the mental health community were doing, and they had developed this initiative called Grand Challenges in Global Mental Health. As a consequence, Professor Rod Hay and I were asked to chair a meeting in London at Willen House, where the ILDS is based, in the end of 2013, almost 8 years ago now, where we identified the grand challenges in global skin health, one of which was psoriasis. And then these things all coming together, the IFPA were doing a fabulous job in with lobbying the WHO, the World Health Organization, to agree and then to declare psoriasis as a serious non-communicable disease. And that initiative really put this into the spotlight. And of course, when the WHO are involved, they promoted the research agenda, but their real key ask from us was that anyone with psoriasis, wherever they live in the world, whether it's Bulgaria, Bolivia, or Britain, they have access to the best available care locally. And then the third organization, the International Psoriasis Council, we're also taking forward a series of workshops. This is one from Munich in 2015, bringing together experts, particularly in other diseases such as eczema, to give us an understanding of how we could develop a atlas for psoriasis. And then as a consequence of all of that, the WHO then published this influential report in 2016. It was only 60 pages, but again, it re-emphasized the importance of understanding the epidemiology. And okay, so an atlas nowadays is not a big book that sits on your coffee table. It's actually an interactive website. And the one that has been recommended to us and which we were very taken with is that developed by the International Diabetes Federation about 20 years ago now. And we actually met with them in Stockholm in 2014. And this is an example of what they've produced. And this is what we hope to have with time with the Global Psoriasis Atlas, which will be all the information you need to know about psoriasis, everything from how common it is to what the resources available are and how it impacts both the individual and society in these in countries across the world. So this is our very ambitious goal, that we will be the leading epidemiological resource on psoriasis globally, and therefore inform research policy and, importantly, healthcare provision. And to be able to do that, we needed funding, and the funding comes from industry and the Leo Foundation. It does not come directly to the people doing the work on the ground. It comes to the International League of Dermatological Societies based in London, who act as the fiscal custodian for the funds. So the people doing the work are at arm's length from the funders. So it was launched at the EADV meeting in October 2016, and the phase 1 work began in April 2017 till 2020, and we're now in phase 2. This is the core team. Myself as the director, Professor Darren Ashcroft as the research director, Dr. Tatiana Maul, who's our medical coordinator, you'll hear from her shortly, Rebecca Swan, who's the program manager, and you'll hear from her at the end of this session, and then in London, Caroline Bark, who's the key project manager on behalf of the ILDS. And then just very briefly, this is our governance structure. This is what's been adopted by other specialties now. So that's that core team, the project management team there in the middle. And then the board of governors is chaired by the president of the ILDS and has the presidents of IPC and IFPA alongside him. And we receive advice, objective advice from our scientific advisory board chaired by Professor Bob Delaval, who's a dermatoepidemiologist based in Colorado. And then the people who are doing the work on the ground is our extensive network of regional coordinators, and now we have national coordinators as well, and particularly well developed in South America, where Claudia de la Cruz from Chile, Ricardo Remiti from Brazil have really put together a very strong group of national coordinators. And then the first part was really to develop and launch the Atlas, which is the website, which fittingly was launched on World Psoriasis Day 2 years ago. So now into phase 2, and these are the focus is now not just epidemiology, but as I'll show you, early diagnosis, the important burden of comorbid disease, and increasingly the health economic impact on both society and the individual. And this is the key paper that we've produced so far. We produced several papers, but this is the most detailed and comprehensive systematic review so far, published in BMJ last year. We know we can say with certainty at least 60 million people around the world have psoriasis. We only have really good data from 1 in 5 countries, and it's highly variable, the prevalence, from 2% or higher in Northern Europe to less than 1%, particularly in the Far East. These are 3 very dynamic and industrious PhD students working on various components. Maha Abu Tawik from Iraq, Alex Trafford from the UK, and Pesley Ngambi from Zambia. And this is work that Peter's going to talk about, and Peter van der Kerkhoff will talk about in more detail. But one of the key things we've noticed when we've been doing field surveys, particularly in Africa, is psoriasis is not diagnosed initially. It's nearly always misdiagnosed as tinea corporis. So what Maha has done, and Peter will explain how the IPC have been instrumental in this, is come up with clinical diagnostic criteria working in the field for non-dermatologists to make an accurate diagnosis of psoriasis. This has been published in the BJD and is now being developed as a training tool for non-dermatologists to work out in the field. Alex Trafford has done some fantastic work looking at the links between psoriasis and cancer. We know that there's a relative risk of cancer mortality, particularly in patients with severe psoriasis. And it's not just skin cancer, it's lymphomas, esophageal cancer, hepatobiliary cancer, pancreatic cancer, and bladder cancer. So these are relatively unresearched areas. We now have studies taking place in Denmark, Israel, Taiwan, and the UK, looking at databases across those countries to see if this was really the case. And it does seem to be the case across all 4 countries. Other work we've done is in fantastic work done by Cristobal Lacaras in Chile, using an inventory there. And what he's shown is that the incidence of psoriasis in Chile is less than we see in Europe, 22 per 100,000, compared with up to 100 per 100,000. And they see far more patients presenting with late onset psoriasis. So that's psoriasis occurring for the first time after the age of 40, which is the opposite to what we see in Western Europe. And then we've done one field trip, of course, before COVID stopped any of that. This was funded independently as a group of us visited the Regional Dermatology Training Center in Moshi, which is run through the International Foundation of Dermatology. We learned a lot there as to how patients are diagnosed and managed in this resource-poor country. And one of the major factors is A, that it's misdiagnosed, but B, is that the travel to a dermatology center may require 2 or 3 days. So no patient can stay on systemic therapy for any length of time. What we did do, though, was do a field survey. We knew of one study that had been performed several years ago, which showed that maybe the prevalence was probably about 0.1% in Tanzania. And that probably was borne out because these 300 people we saw, this survey didn't see one case of psoriasis in that field survey in Maasal land. And then our global collaborations, I don't have time to go into those in detail. You can see here, and we can talk about these in the questions, is the countries that we're now engaged with in a meaningful and robust way. The only one I'm going to sort of give a shout out to is Greenland, where we plan to visit there in May of next year. This is working with Professors Klaus Zachariah and Professor Jacob Tyson from the University of Copenhagen to do an initial pilot study in Greenland, 58,000 population, but we do know there's severe psoriasis there, and then we'll link that into a larger epidemiological census in the country in the following year in 2023. And then to close, the GPA has now been running, for 5 years, 6 years. It has now been looked on as an exemplar by the ILDS for other skin disease atlases. Our structure, the funding, the networks, as I've described to you. And we've had very positive and progressive discussions with Atopic Eczema Group. And in fact, that's now moving forward with some pilot funding from the ILDS for Professor Carsten Floor to put together a global eczema atlas. And then we've had good discussions with the vitiligo teams and also hidradenitis suppurativa. So thank you for that. I'm now going to hand over to Tatiana to continue, and I'll just stop sharing, I guess. I think, is that right?
Yes, thank you.
Okay, yeah. I think you can do that. Is someone going to advance that for you?
Yes, please. Thank you very much for the very kind introduction and the possibility that I'm able to speak today here to you. I feel very honored. This is my part of the Global Psoriasis Atlas. Next slide, please. The Global Psoriasis Atlas, the healthcare study, is the idea is of global mapping of psoriasis to be able to gain a better understanding of the common psoriasis characteristics, thinking and talking about severity, about differences in quality of life, about burden of disease, as well as Professor Griffiths already said, the availability of treatment, the access to treatment. And all this is to better contribute to the further development of our Global Psoriasis Atlas. Next slide, please. As you can see here, we have been on a field trip in Chile at the very beginning, together with Professor Griffiths and also Claudia de la Cruz and Ricardo Romiti, who have been collaborating with us. And here on the map, you can see the different cities I have visited in Chile and also in Brazil, and some pictures of the psoriasis clinics above in Salvador and below in Sao Paulo, where Professor Ricardo Romiti works, and on the right in Chile. This is a cross-sectional multi-center study with 43 centers included and 27 out of those in Brazil and 16 in Chile. And this was done last year between January and April 2020. For our results, you can see in the left with the dark blue, we did see that in Chile, almost 70% of patients have no access to therapy. And in Brazil, it is almost 25% of patients without access to biologics. The conventional systemic therapy care is better, but also not adequate, as we can see. And on the right side, you do see from the treatment, from the patients who do have a severe psoriasis without access to treatment, how their body surface area score and PASI looks like, which is the Psoriasis Area and Severity Index. And we know that above a score of 10, it is defined as a severe psoriasis. And seen in those graphs below, you can see that in both countries, patients with no access have a very severe psoriasis, and there is a significant difference between Chile and Brazil. Overall, I can say that our analysis shows that there is a great underuse of treatment in the field of psoriasis in Latin America, and that there is also large discrepancy between the treatment recommendations out of international psoriasis guidelines and the real situation in the world. And this, to change this situation, this is one of our aims of the Global Psoriasis Atlas. Next slide, please. And therefore, we took the pilot project we did in Latin America with the great help of Claudia de la Cruz and Ricardo Romiti. We took this to build a global healthcare study to be able to include, with the help of all our regional and national coordinators worldwide, to include psoriasis patients, to then be able to understand the psoriasis better and also to understand more about access to treatment. Next slide. And here you can see screenshots out of the tool we use about different biologic treatments and non-biologic treatments and all the questions. And with this, I would like to summarize, and I'm happy to take any questions at the end.
Thank you so much, Tatiana. And we will take questions at the end, so please hold those or put them in the chat. We'll hand over now to Cicely Muburo, who is the Scientific Officer at the International Federation of Psoriasis Associations. Thank you, Cicely.
Thank you. Thank you again for the invite. It's a pleasure to be here and present the working model that is the Global Psoriasis Atlas, and I'll be representing the International Federation of Psoriasis Associations, where I work as the scientific officer. Next slide, please. Perhaps I could start with a brief introduction, and I know you might have had this in previous conversations about the IFPA itself. It's a nonprofit organization aimed to unite psoriasis and psoriatic associations across the globe. Today, IFPA comprises of 61 national members in 53 different countries across the globe, with a regional reach and a regional network of patient associations. And the main aim or the mission is to represent and unite all people living with psoriasis and psoriatic arthritis, regardless of where they live or their geographical positions. Next slide, please. I think my previous speakers, Chris and Tatiana, alluded to this, but I do have a bit of a background history again to the involvement of IFPA and the member associations. This began again way before 2014, where IFPA has been keen to learn from members and has always launched an online survey where members as well as people living with psoriasis are invited to answer particular questions or questions they feel touch on their unmet needs. And in 2014, one of the objectives and the question that was asked on an online survey was, what tools do you feel would be important to build a better world for people living with psoriatic disease? And the response from the survey were presented in a 2014 World Psoriasis Day seminar. And what came out clearly and what was noted from the findings that members called for a resolution stating for both awareness and action for psoriasis. And secondly, everyone wanted a better picture of the demographics of psoriasis. Next slide, please. I think this then culminated to the, as you've heard, the need for addressing of this unmet needs, where the resolution was brought to the WHO by member associations. And I commend the member states who were very strong in providing this to IFPA and heading and lobbying for the global psoriasis resolution, as well as the impact that the questions that were requested was, what was the full impact of psoriasis? And this was poorly quantified back then with again, the lack of that picture. And I do have a little bit of a proof here. I know Chris shared an image of Stockholm, but I do have the pictures of the individuals at that particular meeting from the IPC and the ILDS, not very clear, but it does go to show that a good collaboration did begin at way before today. Next slide, please. And regarding the GPA and how IFPA as well as member associations use it can be looked at into three levels. At the national level, the GPA as well as IFPA member associations have been sharing their collective stories, which are available on the website, and actually showing the humanistic burden of living with psoriasis. We found there's a lot of strength in sharing this knowledge, and the support that has been gained, again, at national level has been quite important. I would also commend, and as Chris mentioned, that the database itself can highlight and is able to highlight what is happening in individual countries, and patients as well as member associations have a conversation and armed with evidence can approach their leaders as well as their policymakers. And at regional level, we've also noticed as IFPA that as we're spearheading the global change and trying to compare across regions and work as a block, the tool as a GPA has been shown to actually assist in the benchmarking, whereby one country can see what a neighboring country is doing and actually work as a block to sort of lobby and reach out in an advocacy capacity. And the IFPA coalition has also been able to work through this and speaking for people living with psoriatic disease. And the third level is at a global level. IFPA is trying as much as possible to use education platforms available as well as the learning opportunities at the IFPA World Conference to share the knowledge about psoriasis and psoriatic arthritis. And this has been through the webinars as well as the conference, and the messaging that we've received as well for the World Psoriasis Day 2021 is based on the evidence that is available on the GPA website. And we've noticed that there's a need to use the scientific evidence, particularly to implement the advocacy actions that we're calling for. Next slide, please. And finally, maybe before I get to the end, the advocacy call and the next steps. People living with psoriatic disease do want their perspectives heard and the experiences shared. And we do not underestimate the power of these conversations that go on at very local contexts. Secondly, IFPA member survey continue to provide more information and patient member associations have approached government agencies using the same data from the Global Psoriasis Atlas, and we're calling it Armed with Evidence, and using this to sort of close the gap between knowledge and action. And finally, the GPA, as you've noted, is actually a tool that is driving equality of healthcare planning globally. And to the final slide. We also have used the evidence from the scientific aspect to raise awareness, as I've mentioned, aligning our message with the scientific evidence and the importance of working with medical communities as well as the patient community, like IPC and ILDS has proven to be a working model that really enables us to drive the advancements for the patient associations. And finally, the IFPA member associations and members remain at the core of our advocacy work. And for the final slide, I'll just have to reiterate that the ultimate beneficiaries of the GPA, if you can move to the next slide, are the people living with psoriatic disease, the caregivers, as well as their families, and that is quite important. Thank you.
Thank you so much, Cicely. It's wonderful to see how involved patient organisations have been and actually spearheading this right from the beginning, but also to see how quickly that data can be utilised on an individual and national and global level for advocacy purposes as well. So I think it's a fantastic achievement. Congratulations. So we'll move on now to presentation from Peter van der Kerkhoff, who is the Chief Medical Officer of the International Psoriasis Council. Thank you, Peter.
Thank you so much for the opportunity to speak on behalf of the International Psoriasis Council. I really would like to address a few slides, and in these 5 minutes really comment why it is that Global Psoriasis Atlas is very important also for the International Psoriasis Council. Next slide, please. The mission of the GPA is to provide the common benchmark on the complete burden of psoriasis in all countries and regions. And the mission of the IPC is to improve the care of people with psoriasis worldwide through education, research, and advocacy. So for us, it's very important to get informed on the Psoriasis Atlas, to understand in the regions of the world the epidemiology of psoriasis in its broader sense, and to adapt our actions regarding access to care on the findings by the Psoriasis Atlas. Next slide, please. We do a lot of education. IPC symposia at international regional dermatological congresses, global webinars, regional webinars, international fellowships, and regional masterclasses. And for us, it's very important to individualize our teaching programs to the regions which we approach. That is, in areas where biologics are barely available, it is not good to speak too much on biologics, but one should present those aspects where really the doctors in the region can work further and have that the doctors have the availability of these drugs. And the field studies of GPA guide the regional teaching activities, and that every masterclass we are so happy to have input from the World Psoriasis Atlas team to give us a presentation. Next slide. Development of clinical diagnosis criteria for chronic plaque psoriasis, an international e-Delphi study. The study of the GPA is very important. That is, the World Health Organization declared psoriasis a global health concern and highlighted the need to tackle the problem of missed or delayed diagnosis. And 3 rounds of an e-Delphi consensus survey were done to establish diagnostic criteria. And panel members were 50 IPC counselors recruited from 27 countries across 6 continents, all of whom were consultant dermatologists. Next slide. What came out of this, as also briefly shown by Professor Griffiths is that the essential clinical diagnostic criterion is the well-demarcated lesions with or without silvery white scales. It's so important that all, not only dermatologists, of course, but all doctors who also see patients with psoriasis are aware of this crucial essential clinical diagnostic criteria. And in addition to that, there are supportive diagnostic criteria. And it's also important that doctors know these supportive criteria, like the pink to red color of the lesions, the vary in size, are palpable, symmetrical distribution, the family history of psoriasis, the nail involvement, the joint pain, stiffness, and itching. And I think it's very important, and we will do that in the future more and more, is, for example, in our master classes, where we teach the experts in the field of psoriasis in regions, but we teach also the teachers in the region to help these teachers with tools that they educate doctors, non-dermatologists, to be able to become better in the diagnosis. Next slide, please. Psoriatic hypopigmentation. That is, in psoriasis, we see also changes quite often in the pigmentary system. And we may see hypo and hyperpigmentation. On these slides, hypopigmentation, healing psoriatic lesions where the skin may approach as if it is vitiligo. And especially in patients with a darker complexion, the discolorations of the skin may be very important and may have a tremendous impact on quality of life. And on the right side, we see a slide of Professor Jörg Prins, who had an enormous interest actually in the pigmentary system. What he describes here is a phenomenon known already a long time, the so-called Voronov zone, where there's depigmentation around a psoriatic lesion. And he actually investigated this Voronov zone and showed an enormous number of melanocytes which cannot produce melanin. And the background of this is that the pigmentary cells contain ADAM-TSL5, which acts as an autoantigen to induce an immune response. And the reality in psoriasis is that you see indeed a lot of pigment cells which are depigmented, which may explain for the depigmentation. But also these lots of cells may at some time indeed get pigmented. And then you see the hyperpigmentation. Next slide, please. Next slide. Where we see tremendous hyperpigmentation also as a result of the participation of the pigmentary system. And again, in patients from underserved areas, this may be quite impressive. Next slide, please. Next slide also shows that patients with pigment disorders may have be similar with respect to the age, the sex ratio, and body mass involved. Hyper and hypopigmentation may be there. Next slide, please. And here again, situation before treatment and during the resolution, where you see depigmentation. In Wood's slide, you can see this more clearly, and hyperpigmentation. Next slide, please. Research and advocacy. Research of GPA provides IPCD information to adapt the education and research efforts to regional needs. The diagnostic criteria will be used in the IPC masterclasses, working together with IFPA to advocate to raise awareness under the GPs. And raise awareness for loss of quality of life is needed related to the pigmentary changes, especially in patients with dark skin. Thank you very much for your attention.
Thank you so much, Peter. That was a really interesting presentation. And again, I think the collaboration really benefits from the expertise of the IPC that are all involved. So it's kind of a great collaboration with each partner bringing their own expertise and strength. So thank you very much. We'll move now on to a presentation from Rebecca Swan. She is the Programme Manager for the Global Psoriasis Atlas, and so very much your first point of contact and the person that keeps everything on track. So delighted to hand over to you, Rebecca.
Oh, thank you very much. It's a pleasure to be here and to see so many of you at this webinar. And the presentations so far, I think, will have shown you exactly how dynamic a project the GPA is. So I will be fairly swift, but I want to let you know ways that you can get involved with the Global Psoriasis Atlas. And as this slide says, we need you. And it's fantastic to be connected and really amplify each other's voices. I think that's really important, and we've kind of heard some of that already from Cicely and others. So first of all, very basic, you've heard about the website. Please do visit the website. We relaunched the website earlier this year based on, we'd made some changes based on feedback that we'd received, and we would love you to visit. You can, as Cicely mentioned, you can download and use the GPA data from your region and country to support your efforts with changing, healthcare policy in your country, and this is really important. And the data is crucially important. What's also alongside the data, as has previously been mentioned, are the patient stories, which really bring that data to life. Living with psoriasis can be life-changing, and it's been really a privilege to listen to the patient stories from all over the world and the different things that people experience, but also the power, again, of connection and support from patient associations. I think that comes across in all of the stories that you'll find on our website. We have a number of resources available on the website. We publish regular blog posts. We have all of our publications there that you can access and download. We publish our annual reports there, and obviously we're fairly due to have a new one in March of next year, but you can access all our previous annual reports there. And you can also, very importantly, subscribe to the newsletter, so that's something else that you can do. And we publish a quarterly newsletter updating on everything that's happening on the project. Next slide, please. You can also engage with us on social media. And if you follow us, we will follow you back. And again, this is really important, liking, comment and sharing content around psoriasis ensures that we amplify all those conversations. Please do let us know what you'd like to see more of across our platforms. We tend to, every now and again, do polls, we ask questions, and please do let us know what it is that you would like to see. You can also share our data and resources with your organisations and dermatology healthcare professionals in your regions and countries. And I think, in particular, when things come online, like, for example, the training tool, those are really important tools to be shared and to be accessed. We do have, we also host the Simplified Psoriasis Index on the website, so you can access that. And we're about to launch some other resources as well in line with World Psoriasis Day. So please do visit the website, keep your eyes peeled on social media, and you'll see some of these really exciting things that we're about to launch. I think as well, when you engage with our campaigns, please do share your campaigns with us, and we will do the same thing. We'll engage with those campaigns. And I think, we've really seen, I'm sure Cicely would agree, that when we do these joint campaigns, it's really powerful, and the engagement that we get is significantly increased. Next slide, please. So this is an example, actually. We are constantly sort of looking at ways to generate conversations and to create content. And this is just interesting. When we looked, we realized that psoriasis was actually tweeted about 220 times in a 24-hour period. If we can join up those conversations and be a part of those conversations, then it really makes a significant difference. Next slide, please. So in terms of patient involvement in the GPA, this, as you've already heard, has happened from the outset. And I would like to thank all of the patients who've been involved in terms of sharing their stories and experiences. And it's really been a profound thing, I think, for the participants and also for anybody who's listening to and following those stories. These are some examples. We're constantly creating new content, working with patients, and you'll see some of the comments here about the impact of the GPA, you know, and how patients consider it to be a really important project. We have had patient stories, which you can see on the website, and we continue to also seek those conversations with patients. And we're just about to run another campaign as part of World Psoriasis Day with IFPA. And if you are interested in taking part and sharing your story, if you are from a patient association, you have psoriasis, please do get in touch directly, because we're just about to do that now. So if you are keen to share your story, we would really love to hear from you. Next slide, please. So I've already said, please do engage with us on social media, and we are on LinkedIn now. You can find videos and resources on YouTube. We're on Twitter, Facebook, Instagram, and as I've already mentioned, the website. So please do, particularly LinkedIn. We're very new on that platform, and we'd love to connect with you there. So you can connect personally with my page, and also Jade Kelly, who is the GPA administrator, and then we will invite you to follow the Global Psoriasis Atlas page as well. You can follow directly, and please do subscribe to our YouTube channel. We put all of the patient stories and any videos that we create there as well. Next slide, please. Okay, so I think, you know, this is really clear that patient involvement has the potential to improve the relevance and quality of our research, and also to shape our research priorities, and that's really important. We have, as I've said, the psoriasis patient stories on the website that are bringing the data to life, highlighting things like impact of disease, misdiagnosis, which we've touched on already, comorbid disease burden, access to care, and the importance of connection. And those are really powerful stories. We have taken part in joint World Psoriasis Day and So Protect Me campaigns, and we'll continue to do that as well, sharing patient stories. I think it's a fantastic platform to be able to do that. We also have patient involvement in specific research projects, and that will only grow and develop over time, and those opportunities will present themselves more and more. So we've had patients involved in reading the lay abstract for the research, ensuring that it's easy to understand and clear, advising on the planned work, and then also we've invited those patients to assist us with advising on effective communication of the results of the research as well. So I think that's a really important thing to end with. There are opportunities for patient involvement in future GPA projects, and again, we'd love to hear from you. Next slide, please. Ultimately, this is our mission. Sorry, can you just go back? Thank you. To ensure that people with psoriasis have access to the best available care wherever they live in the world. And next slide, please. So finally, thank you.
Thank you so much, Rebecca, and thank you to all of our speakers. We hope everyone will stay with us. We have 10 more minutes to have to hear your questions, to hear your reflections on what's been presented. just before we do, and linking to Rebecca's presentation and how we keep psoriasis front and centre in the media and in people's minds, we'd love to take a photo. So if people would be happy to turn their cameras on just for a minute, that would be much appreciated. And we'll take a quick photo that we can tweet and we can share on social media, and hopefully just keep these conversations going. So one of my colleagues is going to signal once the photo, or let me know when the photo is being taken, and then we can move to questions.
Yes, I'll be taking the photo now. Thank you, everyone.
Okay, so hold on.
I've also taken some stuff here, so hopefully we've got.
Okay, so
thank you very much, everyone.
Now everyone can relax, and hopefully you've had time to think of any questions that you'd like to ask any of the speakers. We're also just kind of really interested to hear what your reflections are if you've been using the data from the Global Psoriasis Atlas. Does anybody have any questions that they'd like to pose?
Hello, it's Luca. I just want to thank, of course, Chris, Rebecca, Tatiana, Cecilia, and Peter for the great presentations and for this huge work and impressive work and amazing work, which is really long-term work. My first question is, you are facing a number of challenges. But so with regard to one sentence which I liked from Cicely, she said, armed with evidence. Based on the GPA initiatives and the collected data, were you already able at the national or regional level to have already some impact to access to care, access to essential medicine? When I see the data, impressive data from Chile and Brazil, do you have already some examples what you were able to move on national or regional level?
You want me to make a comment there? So
yes,
please.
Well, thank you, Luca. I mean, this really is a team initiative. I guess that in Chile, we've probably got the most furthest advanced because, you know, payers, governments, healthcare regulators don't actually do anything unless there's data put in front of them. And this is what we do. And then we hand it over to people such as the IPC to educate, IFPA to advocate, and ILDS to advocate as well. But I think in Chile, we actually have got data there now. And of course, from the healthcare survey that has already been run in Chile, Tatiana Moll has done a fantastic job with that. And that's going to, I think, help change the options for patients with psoriasis in Chile. They will have more opportunity to be treated with biologics, more opportunity to be treated with systemics, and they won't have to go through the rheumatology route, which seems to be what was happening in the past. So yes, it is starting to make a difference.
Okay, thank you.
Maybe may I add something here? That is, during the educational activities, what I experienced is also the awareness in regions of the world that more data are needed and that we have to have the systematics for data collection, especially in the Middle East, where I see that patient registries have been stimulated by speaking about the activities of the GPA. Now also in the Philippines, for example, very recently, a patient registry has been started, and in our masterclass that's running now at the moment in Asia, we see an increased awareness that data collection and systems for data collections are needed to come further, and that is a huge difference with 5 years ago.
I can also add something. I am working for IFPA. I'm the Advocacy and Policy Officer. I can speak for international level impact of the data of the GPA. So traditionally in the policy environments like at the UN or at the WHO, we have spoken in the past few years on big diseases like cardiovascular disease or diabetes, and there's always this big 5 diseases that are on focus. Thanks to also to the data of the GPA, we can show we are at least 60 million, and there's now a movement to be more inclusive and include the other non-communicable diseases in the big agenda of NCDs. And this is not possible if you don't know how many you are. So thanks to this data, there is also something moving there at the international level.
Thank you, Elisa. I can see that there's a question in the chat, and there's also somebody with their hand up. So I'll maybe read the question from the chat. It says, how far behind are we to the diabetes patients registry? I'm not sure if there can be a comparison, but perhaps the panelists can think if they do have any comment on that. And in the meantime, I can see that Silvia Fernandez Barrio, you have your hand up. Would you like to ask your question?
One second. Hello, I'm Silvia Fernandez Barrio. I'm from the Patients Organization in Argentina, and I belong to the board of IFPA. And I was thinking while I was seeing, it's great to see you all here, many of you that I look. Thank you very much for the presentations. I was looking at the video that Rebecca put, and there you have the 3 entities, ILDS, IPC, and IFPA. And I was thinking, what if we as GPA address the government with a letter and saying, please, we need this data. We went to us in the ministry at the time of the resolution, and they said at that moment, it's impossible. But I think it's different now. It's 2021, it's not 2014. And maybe we can send so many letters to different countries and we get some answer from some of them and saying, we're working on this. Can we work together? And for example, in countries where you have strong organizations, maybe you can work better with a GPA letter regarding the 3 entities and the patient organization of the country. I think that could give a little bit of strength to what we're looking for, those numbers.
Thank you. Does any of the panelists, that sounds like a great idea. I'm not sure how many of the governments or how that's been approached, and I'm sure Chris will be able to comment on that. But does any of the panelists have any comments on that or the other question that was raised? I can see there's 2 more questions. We only have 1 more minute. So
quickly, just about the diabetes. Yeah, I mean, it's we've learned a lot from them. In fact, Rebecca and some of the team, including Dan Ashcroft, visited there a couple of years ago to their headquarters, and that was a very helpful discussion. And we've learned a lot, and their knowledge has helped us catalyze the speed of development of our registry. That's for sure, for the GPA for sure.
Right. So maybe, I know we're pretty much to time. So I think if we could just have very, very short comments or questions from Ricardo Romriti and Suzanne Gulliver, and then we'll need to close up for the day. So Ricardo, do you want to go first?
Yeah, no, as a regional coordinator for Latin America, I just like to add that one of the barriers for us not to having more access to treatment, not just biologic, but even phototherapy, was always that we had no data in Latin America about psoriasis at all. And with all this information we're gathering with the GPA project, this is really improving, and this will really help a lot our patients to obtain access to treatment.
It's Wayne Gulliver. Data is important. We've confirmed 3% of our population have psoriasis, and we have great access to care, phototherapy, systemic treatments, and biologics for pretty well all the population. So numbers do count, and it goes a long way when you can write to the Minister of Health, tell them that you have 15,000 confirmed cases and that you need these therapies, and they're very keen to come on board and help out. So the data is very important.
That's fantastic. So we're going to need to close up now. I'd like to thank all the presenters, and just to let you know, we'll be sending a brief online survey, evaluation survey to you. So please do put any questions or comments that you missed in that, and kind of what else you would like to know about. I think just it's so impressive to see what has happened in less than 15 years. It may seem like quite a long time, but actually, I think what's been achieved has been fantastic. And I'll just hand over to Luca Borodori to close the meeting for us.
So I thank again warmly all the panelists for this presented work and for the work accomplished. I think that it has been inspiring for us and for all participants. I hope that based on your experience that there will be, as I've already realized, other diseases which will take inspiration and will get the courage to embark in the same important project. I think the key word or the key message is the armed evidence in order to promote our wishes to defend the patient's unmet needs and expectation for a better management worldwide. So based on this, really, thank you very much. It was an exciting webinar, and together with the entire ILDS team and GlobalSkin, I would like to thank all participants and look forward to the next webinars that we can make together. Thank you very much for your contributions and for sharing for us this nice information, important information for our patients.
Thank you so much, everyone. Hope to see you soon.
Thank you.
Thank you. See you soon.
Keep in touch around.
Bye.
Take care.
Bye.